We'll first talk about head trauma. There are usually three types of head trauma, namely concussion, cerebral compression, and skull fracture. Our cranium is a closed area that can't be expanded. Therefore, intracranial pressure will increase when bleeding or edema occurs in result of brain injury. It'll interfere blood supply to the brain, which will lower the victim's level of consciousness and reduce his or her brain function. With an increasing intracranial pressure, blood pressure will go up, while pulse rate will slow down. Direct blow to the skull may lead to cranial fracture, causing confusion or unconsciousness to the victim. What is concussion? When the brain is shaken extensively and temporarily inside the skull, it's called concussion. Causes may include a blow to the head, fall from height, and a blow to the point of the lower jaw. Signs and symptoms of concussion include dizziness, headache, vomiting, temporary loss of consciousness, amnesia, unable to concentrate, and abnormal behaviors such as aggressiveness. The second type of head trauma is cerebral compression. It's a very serious condition. The intracranial tissues are under pressure due to an effusion of blood inside or fracture of the skull. It usually comes with concussion. The victim may have discomfort any time within 48 hours after regaining consciousness. Signs and symptoms of cerebral compression include vomiting, headache, abnormal breathing, which may be sometimes quick or slow, or tidal breathing. The victim may also have slow but strong pulse, increased blood pressure, blurred vision, abnormal pupil reaction, and limb weakness or paralysis. When intracranial pressure increases, the victim's level of consciousness will progressively decrease and may result in seizure. Skull fracture most likely comes with intracranial bleeding and brain contusion. Fracture of vault of skull is usually caused by direct force or head on the ground when falling that may crack the skull, while basal skull fracture is usually caused by direct or indirect force, for example, a blow to the lower jaw. Signs and symptoms of skull fracture include obvious scalp wound, for example, scalp hematoma, laceration, deformity of skull, decreased level of consciousness, conjunctival bleeding in eyes, unequal or abnormal reaction of pupils. Victims may have bruising around the eyes, which is also known as raccoon eyes. There may also be bruising over the mastoid process, which is the back part of the temporal bone. In case of basal skull fracture, there'll be bleeding or cerebrospinal fluid profuse from the nose and ears. In case of blood accumulated inside the skull, victim will have signs and symptoms of cerebral compression. How should we manage the above head traumas? First, don't forget the procedure of primary survey, DRABCDE. After that, immobilize the cervical spine by using both hands to hold the victim's head. Check the victim's vital signs and level of consciousness every few minutes. You should also pay attention to the following 2 points when you are trying to control bleeding. Do not fill any dressings in the ear canal or nostril. Do not apply direct pressure or elastic bandage on the wound if skull fracture is suspected. If the victim is conscious without neck injury, place him or her in supine position with head elevated. If neck injury is suspected, place the victim in supine position on hard surface, followed by management of cervical spine fracture. During managing victims with head trauma, always stay alert to the possibility of spinal fracture. We'll proceed to eye trauma. It can be divided into 3 types, including foreign body in the eyes, injury to the eyes, and chemical burn. Remember to wear protective gloves whenever you manage eye trauma to prevent infection from victim. Don't apply pressure on the eyes or increase the pressure in the eyes. Don't rub the eyes and avoid coughing or sneezing. Don't attempt to wipe off the blood or blood clots. When bandaging, cover both eyes to reduce movement of eyeballs. Avoid pressure on the eyes. Place eye wash cup or pocket mask on the injured eye for protection if necessary. Explain every procedure to victim beforehand to reduce his or her anxiety. If the foreign body in the eye is sand, debris or cosmetics, irrigate or wash out the eyes from inner corner to outer corner with suitable amount of saline or clean water. If an object is impaled in the eye, cover and stabilize the object to avoid movement. After that, send the victim to hospital immediately. If an eye is injured, cover it with sufficient clean and non-fluffy dressing. Send the victim to hospital immediately after bandaging. If an eyeball sticks out, cover it with sufficient clean and non-fluffy dressing. Then protect the eye with eye wash cup or pocket mask, bandage the protector loosely in position, and avoid further harm to the injured eye. After that, send the victim to hospital immediately. If the eye is burned by chemical substances, remove contact lens if any, irrigate the eye from inside out with plenty of water for at least 20 minutes, prevent the flushed water from contacting the skin and eyes of the victim and the first aider. After that, cover both eyes with clean and non-fluffy dressings and send the victim to hospital immediately. Ear trauma can be divided into foreign body and ear, external ear injury and bleeding from the ear canal. In case of foreign body and ear, don't attempt to take it out and send the victim to hospital immediately. In case of external ear injury, cover it with sufficient clean and non-fluffy dressings and send the victim to hospital immediately. In case of bleeding from the ear canal, don't fill any dressings in the ear canal. Cover the ear pinner with dressing and tilt the head to the injured side and send the victim to hospital immediately. We'll now talk about oral trauma. Oral trauma is usually caused by accidental collision, fall or biting. The injury can be minor or serious. To manage oral trauma, first we should perform primary survey DRABCDE. After that, wear disposable gloves before contact with the victims. Control severe bleeding and prevent or treat shock if necessary. You should allow blood to drain out of the mouth. Don't swallow the blood. You can apply gauze on the wound and use fingers to apply direct pressure for 10 to 20 minutes. If bleeding continues, apply gauze with direct pressure for another 10 minutes. If the trauma is extensive or bleeding can't be controlled within 30 minutes, send the victim to hospital immediately. Moreover, in case of any tooth avulsion, early reimplantation of a avulsed tooth or keeping the tooth in suitable media liquid can increase the chance of tooth reimplantation and healing. Signs and symptoms of tooth avulsion include hemorrhage of tooth socket, damage of soft tissues, complete detachment of the tooth from its socket, and pain. To manage victim with tooth avulsion, reassure the victim to stay calm. Try to find the avulsed tooth and place it in suitable liquid, such as milk, propolis, electrolyte supplement, and the victim's own saliva. If the bleeding of tooth socket or soft tissues is not controlled, apply gentle pressure with gauze. After that, the victim should seek dental consultation immediately. Nose trauma can be divided into nasal bone fracture, nose bleeding, and foreign body and nose. The principles of managing nose trauma include asking the victim to breathe through the mouth, avoid coughing or sneezing, and not to swallow the blood to avoid vomiting. If the victim has nasal fracture, cover his or her nose with dressings and secure with adhesive tape. After that, send him or her to hospital immediately. If the victim has foreign body and nose, don't attempt to pick the object out by yourself and send him or her to hospital immediately. In case of nose bleeding, we can help the victim to sit upright with head leaning forward, apply a cold pack on forehead, and use fingers to pinch the soft part of the bridge of the nose for about 10 minutes. Advise the victim to breathe through mouth. If bleeding continues, pinch the nose for 10 more minutes and repeat the action if bleeding continues. However, if bleeding is not controlled in 30 minutes, send the victim to hospital immediately. As for chest trauma, any injuries or trauma on the chest wall are alarming. Even when there aren't any obvious visible external wounds, the heart, lungs, or major blood vessels may be damaged. You should assess the possibility of the following 5 types of life-threatening trauma, including flail chest, open pneumothorax, tension pneumothorax, hemothorax, and cardiac tamponade. The first type of life-threatening trauma is flail chest. It's common in car accident when the driver strikes on the steering wheel. The victim may have multiple fractures at ribs or sternum, among which there may be broken parts sometimes pushed into the lungs or heart. Signs and symptoms of the condition include severe pain. There may be paradoxical movement on the injured site while breathing, which means that the chest wall moves in during breathing and moves out during expiration. The victim may also experience breathing difficulty or even suffocation. He or she may also show cyanosis around lips, fingernails, and face due to insufficient oxygen supply. To manage victim with this condition, place him or her in an appropriate and comfortable semi-sitting position and leaning to the injured side. Encourage the victim to breathe normally, assist breathing when necessary, then send the victim to hospital immediately. The second type of life-threatening trauma is open pneumothorax. Why would the condition occur? It's because air or gas is trapped in the pleural space. This exerts pressure on the lung. The affected lung is then collapsed, causing breathing difficulty. Sucking chest wound is one of the causes of pneumothorax. What is open pneumothorax? It is caused by an open wound in the chest wall which perforate the pleural membranes. Air can then enter between the membranes and exert pressure on the lung. The affected lung is then collapsed and results in severe breathing difficulty. Signs and symptoms include breathing difficulty or suffocation. In case of sucking chest wound, there may be sound of air entry through the wound into the chest when the victim inhales and blood bubbling out of the wound when he or she exhales. He or she may also cough up frothy red blood. To manage open pneumothorax, perform DRAB-CDE first. After that, stop bleeding by applying direct pressure over the wound without covering it entirely. Cover only part of the wound. Then, leave the wound uncovered after bleeding stopped. If there's a penetrating object, apply plenty of dressings around it for stabilization. After that, you can put the victim in semi-sitting position or recovery position for victim in shock or coma, and send the victim to hospital immediately. If necessary, for example long travel, use permeable dressing to cover the wound. What is tension pneumothorax? When the chest wall and pleura are injured, air enters the pleural space during inhalation and exert pressure on the lung. The affected lung is then collapsed, causing failure of gaseous exchange. The pressure built up in the chest wall may block the blood refill of the heart through veins. Then the cardiac output and the blood pressure will be decreased. If the pressure in the chest is too high, it'll also affect the uninjured lung. The signs and symptoms of tension pneumothorax include breathing difficulty, distension of veins in the neck, cyanosis at later stage, or even severe shock. To manage the condition, perform DRAB-CDE, then send the victim to hospital immediately. The fourth type is hemothorax. When blood flows into the pleural space due to rupture of blood vessels in the chest, blood loss can exceed 1.5 liters, and the lung will be severely compressed by the pooled blood in the pleural cavity, causing impaired gaseous exchange. This is called hemothorax. Signs and symptoms of the condition include breathing difficulty and shock. To manage the condition, you should also perform DREB-CDE and send the victim to hospital immediately. Lastly, cardiac tamponade occurs when heart or its blood vessels are injured, making blood flows into the pericardium and pools in the sac. The function of the heart is then impaired and cardiac output is reduced. Signs and symptoms include shock and distension of veins in the neck. The management of the condition is just the same as that of other conditions mentioned before. Perform DREB-CDE and send the victim to hospital immediately. In case of any abdominal trauma, victim will show signs and symptoms including different degrees of abdominal pain, tenderness and swelling. He or she may have rapid and shallow breathing. There'll be bruises over skin or bleeding. The victim's guts may protrude from the wound and shock may occur. To manage victim with abdominal trauma, perform DREB-CDE first. After that, place the victim in supine position with knees slightly flexed and supported to avoid stretching of the wound. Then stop bleeding by applying direct pressure. If there are any exposed guts or organs, cover them with plastic wrap. Don't compress the wound or try to put the exposed guts back into the abdomen. If plastic wrap isn't available, soak the sterile gauze with saline and apply it on the wound. If there is a penetrating object, apply plenty of dressings around it for stabilization. Don't give the victim any food and drinks, and send him or her to hospital immediately. As for amputation, the signs and symptoms include partial or complete detachment of body parts. There'll also be massive bleeding and signs of shock. To manage amputation, first perform DREB-CDE. After that, stop bleeding by applying direct pressure. Reassure the victim, and then bandage the wound and stabilize the partly detached limb. Meanwhile, prevent or manage shock. Lastly, wrap the amputated part by clean dressing, plastic wrap, or triangular bandage and put it in a plastic bag. Then, put the bag in a container or plastic bag filled with ice water. If ice isn't available on site, put the wrapped amputated part into a plastic bag and send the victim together with the amputated part to hospital as soon as possible for reattachment. Don't let the amputated part contact with ice or water directly. The last condition is crush injury. If the victim is crushed by a collapsed house or machine, blood will leak into the injured areas after the removal of the heavy object, causing swelling and tenderness there. Victim will experience rapid drop in blood pressure, causing severe shock. Prolonged crushing may cause extensive damage to muscle. Toxic substances will build up and may even cause renal failure. Signs and symptoms of crush injury include tingling or numbness at the injured part and redness, swelling, or cold to touch at compressed sites. Victim may also show signs and symptoms of shock or fracture. To manage the condition, perform DREB-CTE first. After that, remove the heavy object from the victim and help the victim lie down. Then, prevent and treat shock. Don't move or elevate the injured limbs unless the use of arm sling is required. After that, send the victim to hospital immediately.